And good morning, everyone. Welcome to the webinar. Jeff Beglin here from Cornerstone, alongside my friend and colleague, Bill Vaughn. He's over in Indianapolis with Golden Rule, UnitedHealthOne. Let's do some housekeeping. Okay. Let's see here. Okay. You guys know the drill. If you have a question, you'll put that in the question box. We'll get to those at the end of the presentation. We might jump in throughout and pose a couple questions to Bill, but be sure to add those questions to the question box. And next slide. Here we are, the dynamic duo of the individual market. We are knee-deep in OEP right now, and it's going to unfold from now until mid-January. Certainly, if you have any questions, and there are lots of questions about the markets, and not only the ACA, but the short-term markets, and the ancillary and everything else, dental, hospital indemnity, everything. Give us a call, send an email to me. There's my email address, my phone number. And Carla is more of a back office specialist, and she's helping behind the scenes with all the inner workings of the different plans, and helping out with billing issues, and doing just a lot of stuff for all of our agents. So, and with that, I'm going to toss things to Bill Vaughn. He is sales rep for Golden Rule, and what we now call UnitedHealthOne. And let's see, I think I can see your screen, Bill. Take it away.
Perfect. Well, thank you very much, Jeff. Can you hear me okay?
Yes, I can. Now, if you guys wouldn't mind, if one or two of you would give me the thumbs up in the Q&A that you can hear us and see our screen well, that'd be great. Okay. Okay. Out here in the Q&A. Let's do it. Okay. Thanks, Bob. Thanks, Jen. Okay, take it away, Bill.
Okay. Well, thanks, Jeff, and thank you to the agents that are attending this morning. Like Jeff said, OEP, AEP, this is your Super Bowl. So I certainly appreciate the time that you give me this morning to share a few things with you. And like Jeff said, it appears, if you were reading the tea leaves out there, that it doesn't look like the Republicans are going to approve the enhanced subsidies. So for those ACA clients that you may have on your books, they're going to be looking for an alternative to ACA, a little bit lower cost premium for ACA. And that's what I want to talk to you about today. Our tri-term plans, which are 3-year short-term plans, not approved in the state of Ohio as of yet, but I know some of you also sell in the state of Kentucky. They are in Kentucky, and I'll share that grid map here with you in a moment, showing you exactly where those plans are available. I'll give you an update on the short-term, longer duration, short-term medical in the state of Ohio. I'm also going to talk to you briefly about another option to ACA, our Health Protector Guard 3 fixed indemnity product, and then some housekeeping items on a nice bonus opportunity that we have available to you. Give you some contact information for our broker service center, contracting, and appointments. And as Jeff said, my name is Bill Vaughn. I work with Carla and with Jeff and with Ryan over at Cornerstone. You all have been great partners with us over many, many years. And I want to, again, thank you for attending this morning. So in addition to the strong pre and post 65 product portfolio that we have at UnitedHealthOne, some of you may know us as Golden Rule Insurance Company. We've been around forever. We're headquartered here in Indianapolis, Indiana, but a lot of attention in the past few years to building out our guarantee issue options, which there's a big market for, as everyone knows. Guarantee issue wasn't a part of our portfolio 5 to 7 years ago, but now we offer a GI option in virtually every ancillary product category. You can see on the screen, this chart sort of shows you at the top our core medical products, which are our short-term medical, and then our Health Protector Guard fixed indemnity product. In the yellow highlighted area, you'll see ancillaries that have both guarantee issue options, with a few of them having both guarantee issue and simplified issue options. So that's sort of a look at our product portfolio that we have available to you all as appointed agents with UnitedHealthOne. Here's a look at the map. You know, we've got a very, probably the biggest footprint of any carrier in the business, with having 3 or more products in 49 states. We've got a few states in the light blue area that are colored: Vermont, Massachusetts, Washington, where we offer 3 or less products. And then there's a few states in the upper Northeast where we don't offer any products at all. But our map is pretty well filled out across the country, having full coverage products. So, as I said earlier, what I want to talk to you about today is an alternative with the enhanced ACA subsidies not being renewed. I know we all read the news, and there's a lot of angst out there, if you will, with the folks that have ACA plans about how they're going to afford these ACA plans. And especially this year, with the average cost going up about 20% for 2026 plans versus 2025 plans, how are they going to afford that without those enhanced subsidies? So the 2 options that I want to talk to you about today is our short-term plans, our Health Protector Guard enhanced fixed indemnity plans, plus the ancillary plans to help strengthen up the coverage for the clients. And I'll show you a couple of quote examples here in a few minutes as well as a standalone plan. For those folks that are still, going to remain on the ACA books, we have some very strong ancillary plans: our hospital plans, critical illness, critical guard plans, our Health Protector Guard 3 fixed indemnity guard plans, which have a lot lower monthly premium, but they fit real nicely to help with the out-of-pocket cost that ACA represents. Accident plans, and of course, as Jeff said earlier, dental and vision plans. For Medicare members, for those agents on the line that sell Medicare Advantage and have a book of business there, we offer Advantage Guard, which is a hospital indemnity plan, but it does cover a lot more to help fill the gaps that the Medicare Advantage plans leave behind. Hospital plans, critical illness, accident, and then we've got a very nice Dental Wise Max, a DVH product for dental, vision, and hearing. This is a look, and for those of you that are familiar with quoting us on your broker portal, which we call eStore, this is the map that pops up when you first log into eStore, and you can see the products that you're appointed in the various states and what type of coverage options, or I should say product options, we offer. Over to the far right, I cut the map off at Ohio, and you can see that most of the products are offered in the state of Ohio, with the exception of the tri-term medical. And as I was sharing with Jeff, before you all joined this morning, Jeff and Ryan have asked me many times, as well as a lot of people in Ohio, a lot of agents have reached out to me about when are we going to be able to get the longer term duration short-term plans back in the state of Ohio. So in turn, I push our product committee, and I did get a confirmation yesterday afternoon from a fellow by the name of Justin Wolford, he's on our product committee. And he said, I think it's going to come back mid-December, Bill. And I said, no, I need a confirmation. I'm going to meet with the biggest FMO with their agents, Cornerstone, tomorrow, and they're going to be asking, and they're going to be wanting to know when the short terms are coming back, and I want a confirmation on it. So Justin got back with me yesterday afternoon and said December 19th, the new sales for short-term medical longer durations in Ohio have been approved. That'll be a 12-month short-term plan. And to give you just a little bit of a backdrop on what transpired there, and most of you know this already as well, But the Trump administration, of course, said, "Hey, we're not going to go after any states that sell longer than a 3+1 short-term plan." That the Biden administration last September said, "Hey, you can only sell 3+1 short-term plans." So the Trump administration said, we're going to let the states decide on what they want to do. So United Healthcare went out, and the other carriers went out to the different state DOIs and said, "Hey, what do you want us to offer to the residents of your state, or be able to offer?" Well, we figured Ohio would go right away with a 12-month short-term plan. They didn't. They sort of sat on the sidelines to see how things were going to shake out in this market. Some other states that are also very big with us at UnitedHealthOne, Texas is one of our biggest states. North Carolina is a big state. Both of those states offered 3-year short-term plans or tri-term plans in past years. So including Ohio, those were 3 big states that we've just sort of sat here on the sidelines and waited for the state to give us the green light to be able to sell. Well, thank goodness it's still here, and we're actually going to get it in the state of Ohio right before those ACA customers are forced to make a decision for a January 1st start date, either to consider to continue their ACA at the higher prices without the enhanced subsidies, or look for a different option. So as not as soon as we would have liked 12/19, but hey, we'll take it.
That's terrific news, Bill. We're popping champagne corks here. I know it's a
Good,
little early,
good.
but we're gonna.
Send me a bottle, Jeff.
This is gonna be great. This is just fantastic news.
Good.
I've been getting this question on a daily basis. When's UH1 going to offer those 12-month plans again in Ohio?
Yep.
Now it's here, just a month away, guys, and
Right.
more to come on that. Bill, do you have an idea when we can start quoting it, or I know I'm jumping the gun, but what's your time frame on that?
I don't, Jeff. I just got the confirmation yesterday that it was the green light with the state of Ohio for December the 19th. But typically, when we come out with a new product, or when we relaunch a product like we did with the longer durations in the other states for the short term and also the tri-term medical, there'll be a lot more communication, forthcoming. But I'm sure you'll get it a few days to be able to quote it. Maybe the 15th, you'll be able to start quoting, but don't hold me to that. Okay. I don't really know how things are going to roll out there, but I will keep you and Ryan posted, Jeff.
Yes.
And as much information as I can, as timely as I can. That's my promise to you.
And we'll be corresponding with you guys, the agents. And by all means, if you're not appointed, and I doubt that's the case here, but if anybody on the call is not appointed, give me a call pronto, and we'll get you appointed for UH1.
Yep. Yeah, I know Jeff and Sandy can get you going very quick. They're on top of it. So the short-term medical durations, so if you have appointments in other states, you can see I've highlighted Kentucky. Kentucky's back. They've been back for for over a month with the longer duration short-term plans. Ohio's not been added in here yet because it's fresh off the press, so to speak. For those of you that are in some other states, including Kentucky, we are offering the tri-term 3-year plan, which is a great alternative to ACA with 3 consecutive 12-month short-term plans attached. So for those of you that have marketed our United Healthcare plans in the past, having that brand in your portfolio, as you all know, is beneficial in a lot of ways. Our brand really does bring about the ability to resonate more with your consumers, in addition to helping you build out a more profitable and hopefully sticky book of business. The UHC networks, which are built in all plan offerings, are some of the largest networks in the country. And I'm going to talk a little bit more about that network. This 1.5 million in the orange bracketed area, that's actually grown to 1.8 million. And this was a 2025 slide. The other thing to let you know about our network is we're excited to leverage what we call Opt and Perks program to offer auto adjudicated claim processing on our Health Protector Guard fixed indemnity products. So I'm going to go into a little bit of detail for you on the new short-term medical plans. You know, we've been the leader of this at Golden Rule Insurance Company, UnitedHealthOne, for over 30 years, offering high quality short-term medical plans to your consumers. So what you're going to see here, there are many different short-term medical plans available. The variety of products allows us product flexibility, and product flexibility really means a couple things. For your clients, it means there are plenty of coverages choices to help them meet their needs and their budget. It may sound cliche, but clients really want to buy. They don't want to be sold. Having product flexibility really kind of accommodates that. For you, our agent broker distribution base, it means increased opportunities to match the client with a product that meets a variety of different coverage needs primarily. So as you all know, no two clients are the same. Having a broad product portfolio allows us to help achieve the perfect fit for our clients. It's also important that the plans have several different coverage options, and the short-term medical plans have really just that. As you know, the benefit levels and state variations associated with the plans are extremely important. So always view the product brochure when you're discussing the plans with your clients or your prospects to ensure you're providing an accurate plan and description to the client. It's also important to know that the short-term plans, they all have their own deductible, their own co-insurance, and their own out-of-pocket limits. As you all know, you're experts in your business. Increasing deductible and co-insurance will give the clients a lower monthly premium. So there are 6 different short-term medical plans that we're going to come back with in the state of Ohio on December the 19th. And the range of plan offers your clients pricing and coverage flexibility. Now, I'm not going to discuss the hospital and surgical short-term plan with you today because it's significantly different in the benefit structure. And I'll point that out as we go through this. But the name hospital and surgical primarily covers hospital and surgical benefits. And those plans have their own brochure. So make sure you review those on your e-store for further plan and coverage details. So now we're going to take a look at the plans that we have available, that we're going to have available in Ohio here very quickly. We have the value plan. We have the plus plan, the plus elite, premier elite, and then the short-term medical copay plan. So same lineup that we had before the extended durations were limited back in September of 2024. So the deductible options are going to range for all the plans from a low of $2,500 to a max of $15,000. Deductible is per covered person with a maximum of 2 per family. Our plus plan has a 20% co-insurance, and the client has a co-insurance out of pocket of $2,000 after their chosen deductible for in-network covered expenses. The next plan is the Premier Elite and the Plus Elite. Both of these plans include a lifetime maximum of $2 million per covered person. Values the lowest price plan, of course, as the name implies, and overall includes a lifetime maximum of $1 million per covered person. Both of these plans have no co-insurance or out-of-pocket. After the deductible is met, the plan pays 100% for eligible benefits. For Plus Elite only, the client can choose one of 5 per term deductibles, ranging again from a low of $2,500 to a max of $15,000 deductible. The deductible again is per covered person with a maximum of 2 per family. And for the Premier Elite only, the client can choose one of 3 family deductibles. Their choices are $5,000, $10,000, or $14,000. The family deductible is per term with 1 deductible to meet for all covered family members combined. Now I want to take a look at the benefits. I'm not going to read the screen to you. I'm going to kind of flash it up. And as Jeff said earlier, as you look over some of the coverages here, if you have any questions, put them in the chat box. And Jeff, certainly, interrupt me at any time so that we can answer a question.
Actually, we'll go put them in the question box, the Q&A box at the top, because I think the chat might be disabled. Okay. So just a quick one. Do these apply to Kentucky as well? Do these changes or these
Yes.
designs? You said yes.
Kentucky actually went to the longer durations a little over a month ago, about a month and a half ago. So in Kentucky, you have the short-term 12-month plans, and you also have the 3-year tri-term plans, which are basically 3 12-month short-term plans back to back. They go through underwriting the first time for the first duration, and then after that, they issue for the next 3 years. It's 3 years less 1 day on tri-term plans, but those are in Kentucky.
Great.
So just to kind of look here, this is the deductible, the co-insurance, and the max benefit levels. This next screen that I'm going to show you shows you how the 3 different plans, and by the way, these benefit grids are in your e-store, your broker portal. When you click on the short-term medical plan brochure, you'll be able to pull these up and see exactly. So as I said before, I'm not going to read this screen to you. It's kind of a busy screen. But just as an example, the short-term medical value office visits, they don't have a copay, as you'll see on the screen. They're covered subject to the plan's deductible and 30% co-insurance. Now, the plan does offer a $50 copay for urgent care visits, which are not subject to the plan's deductible or co-insurance. After the deductible is met, the use of urgent care benefit would still require a copayment from the member. I do want to point out that for preventative care, the emergency room for accident and illness, inpatient hospital services, outpatient surgery, labs, x-rays, there's no copay, and they're covered subject to the plan's deductible and 30% co-insurance. Preventative care is subject to what is outlined in the policy certificate. So make sure you review that product brochure on eStore for more details. There is an additional $500 deductible for emergency room visits if there is no hospital admission. That's an important note for you all. With the short-term medical plus, which is, I'll tell you, our most popular plan, office visits don't have a copay. Again, they're covered subject to the plan's deductible and 20% co-insurance. The plan, again, does feature a $50 copay for urgent care visits, and that's not subject to deductible or co-insurance. Preventative care, emergency room, accident and illness, inpatient hospital services, outpatient surgery, other labs, x-rays, or no copay, again, subject to deductible and co-insurance. So for the Premier and the Elite plan, an important note, office visits don't have a copay. They are covered at 100% co-insurance after the client has met and satisfied the deductible. Those are very popular options as well. Those are more at the upper end of the premium levels because they don't have that co-insurance to them. So very easy to explain to the client. Preventative care, same thing, subject to deductible and co-insurance. The short-term medical copay plan, it has a $50 copay for doctor visits. They're limited to 1 to 4 doctor visits per person per term, depending on the duration of the plan. So subsequent visits, I get this question asked a lot. If they're on the medical copay short-term plan, once they exhaust the 4 doctor visits, are doctor visits still covered? They would still be covered subject to deductible and co-insurance. And remember that it's part of the United Healthcare Choice Plus network, which is going to give about an average of a 58% discount off the door rate, if you will, for the doctor visit. So I'm going to cover an example of how doctor visits would be covered here in a second. But yes, for more than 4 doctor visits on the copay plan, those would be covered as well. So pharmacy benefits, just take a really quick peek at that for all 5 plans. Prescription drugs, which are tier 1, they'll have a simple $25 copay with no deductible. For the copay and plus plans, tier 2, 3, 4, tier 2, 3, and 4, drugs are covered at 20% co-insurance after the deductible has met. Same thing with Premier and Elite. Once deductibles met, there is no co-insurance. These are all subject to a $5,000 maximum drug benefit for covered expenses per term. So, and again, this grid, which is very busy. It's in the brochures in your e-store. The short-term medical plans, they also cover some common preventative care. Some covered services includes 1 mammogram, pap smear for females, PSA screenings for males, prostate cancer screening per eligible member per term. The insured will pay at the plan's co-insurance level once the deductible plan is met. The coverage, of course, is not included on the hospital and surgical plan that I mentioned before. So make sure you look at the brochure to make sure that you're giving your clients the proper information. The plans also cover, pardon me, outpatient x-ray and labs. These services are covered, the plan's co-insurance and deductible. Surgery is also covered in a doctor's office at an outpatient surgical facility, including services and supplies. It's a covered expense, again, subject to deductible and co-insurance options. ER, emergency room fees, are covered on the short-term plans as well. This is for visits due to illness or injury. The insured will pay at the plan's insurance level once the plan's deductible is met. Spine and back disorders, we always get a lot of questions on spine and back. Those are covered as well on the short-term plans. The insured will pay at the plan's co-insurance after the deductible has been met. By the way, there is a $2,500 maximum covered expense per person per term for outpatient non-surgical back and spine issues.
Can I jump in real quick?
Sure.
Okay. We answered the question about Kentucky. New question though.
Yeah.
Tammy asked, do they all have pre-existing? What is the waiting period or look back if it does?
Well, I'll answer that maybe a little different than what it was asked, Tammy. You know, our short-term, all of our plans at UnitedHealthOne, our short-term, our ancillary plans, our health protector guard, fixed indemnity plans, which I'm going to talk to you in a minute. Those are all simplified issue. And what we mean by that, how we define that, is we ask the questions on the application, and the way the client answers those applications is it's either an accept or decline. There's no underwriter that really looks at the applications and says, yes, no, yes, no, yes, no, you get insurance, you don't get insurance, so to speak. The only plan that an underwriter is actually physically putting their eyes on at UnitedHealthOne Golden Rule are our tri-term plans. So going back to your questions on pre-existing conditions, on the short-term plans, and Jeff, if I have not shared with you in the past all of the sample applications on a link, would you please remind me at the end of this call, and I'll email that over to you, to where you can look at the questions that are going to be asked once you apply. Their sample apps by state, even by county.
Oh.
Have I shared those with you?
I think these are just sample apps. It's not where you're going to apply, because you're going to apply online.
That they are going to apply online. The sample apps are just going to give you an idea of the questions that are going to be asked. So going back to Tammy's question about pre-existing conditions, it's going to ask a question on the short-term plan, and forgive me if I don't have this verbatim, but has any person applying for coverage in the last 5 years had a heart attack, has experienced a heart attack, cancer, stroke? And if they answer yes to that question, then it's going to stop you right in your tracks on a simplified issue application. You're not going to be able to finish the application. So look back really doesn't come into play, but it's going to be the questions on how they're asked on the application. Does that make sense?
Yes, absolutely. Thank you.
Okay. And I'll send you over that link, Jeff. Share it with everybody in your organization, and you can kind of look and get an idea if you're dealing with someone that may have, you know, a big pre-existing condition. You know, I like to say, and I've been in this business, you know, for quite a while as well. I've sold these plans as well, quite a while ago, but I've sold all the plans here. And, you know, if it's something small, you know, typically we're going to omit them. You know, they're going to be able to be underwritten with us. But if they do have something serious, major going on, heart issues, lung issues, big things, then they're probably not a good fit for this short-term plan. They would need something more on a guarantee issue basis through either the ACA or some other type of plan. But in the state of Ohio, the plans all offer coverage through the United Healthcare Choice Plus network. Great network for those of you that are familiar with it. It's a preferred provider organization, PPO. That means the clients have the flexibility to see a doctor in or out of network without a restriction. Keep in mind, if they see providers in the network, they're going to receive the highest level of benefits from their plan. If an insured uses an out-of-network provider on these short-term plans, there'll be a reduction in their benefit. So just be aware of that on the reduction of benefit. Emergency treatment from a non-network provider will be considered as an eligible in-network service. Okay, so try to stay in network. It's not hard to stay in network with this Choice Plus plan. It has over 1.8 million providers nationwide, coast to coast. These plans travel very, very well. So for those clients that may have been on ACA for the last 3 or 4 years, we've all heard it. I don't like the networks with the ACA. They're regional. They're very restrictive. HMO or EPO networks. Well, you've got a really bright, shining light to offer those people with these short-term plans with United Healthcare Choice and Choice Plus network. They don't need a primary care doctor to refer them to a specialist. There's about 7,200 hospitals and 1.8 million providers nationwide, coast to coast. The clients are going to have their choice of network providers in other parts of the country as well, because they are, as I say, nationwide, coast to coast. Using the network providers means the clients can save some of their hard-earned money, and because those providers have agreed to offer discounts for covered services. The average discount is 58%. I'm going to give you an example here in just a moment of how that would work. So, great network, something really nice to talk to your clients about. Now, premium payment, clients have flexibility when it comes to making their payments. Clients can pay their initial and monthly premium on EFT, electronic fund transfer, or by credit debit card. Payment will not be processed until the plan has been issued or the effective date, whichever latest. I'm going to get up on my soapbox here real quick and tell you that EFT is the best way, for you to be able to retain your customers. The persistency of folks that pay with United Healthcare for a United Healthcare plan, I should say, for their monthly premium, those policies stick on the books much, much longer. I could go through the list, and it's better. It's a more reliable payment method for the consumer. I could not tell you how many times claims have sent us, I work in sales, how many times claims have sent us stats and statistics of people calling into our claims center and saying, "Hey, I've got this plan, but United Healthcare denied the plan, said I didn't have coverage." Guess what? When our claim center goes back and traces it back, they paid on credit card, the credit card was compromised, or the credit card was maxed out for the month, and guess what happens? They don't pay their premium for 30 days. They don't respond to an email that comes from us or from you, the agent, to make sure that they're staying up with their premium, and they don't have insurance, and they've got, big hospital bills that aren't covered because they're not insured. EFT is by far the most reliable payment method. So I'll get off my soapbox there, but proof's in the pudding when it comes to EFT payment method. So regardless of the payment plan method, there is no application fees on any of our short-term plans. Effective date, another big advantage of our short-term medical plans is the ability for your clients to get coverage quickly. There is no open enrollment period. The primary insured must be between the ages of 19 and 64. Typically, we can start these plans as quick as the next day. So if you talk to a client today, they need it to start tomorrow, you can start that with completing the application today. Underwriting to simplified issue typically takes no more than 24 hours. The earliest possible effective date is the day after the application is received, pending approval. These plans have no waiting period. The effective date for injury and illness is the same as the effective date on the policy certificate. So I'm going to share a little bit with you about why individuals struggle with healthcare cost. And I know I'm preaching to the choir with this group of very tenured agents, but what many of your clients may not understand is those that have ACA, that still likely leaves them with some financial responsibility for medical services. Many of the clients may not expect something major, of course, like a hospitalization or a serious illness or injury, and they probably don't have a financial plan for something like that. And that may be the best reason that I want to talk to you about our Health Protector Guard, fixed indemnity, and our other ancillary plans. Basically, help for the unexpected. The Health Protector Guard benefits can help alleviate or possibly eliminate some of the out-of-burden medical cost expenses. Health Protector Guard, the fixed indemnity product, can supplement core insurance coverage or can be used as a standalone plan with fixed benefits for covered services. That extra layer of coverage could be very important because the rising cost of hospital expenses that we all know, combined with an increasing number of clients choosing higher deductibles. That means clients are looking for this kind of help when it comes to their out-of-pocket medical expenses. The cost of hospitalization has increased 7%, and this is kind of a little bit older data. We're still waiting on the 24 to 25 data to come in, but it's increased. The cost of hospitalizations increased 7% from June of 23 to June of 24. That's 2 times greater than the overall medical cost increase. The average cost of a 3-night inpatient hospital stay is over $9,000 per night. Along with that, the average maximum out-of-pocket for the Affordable Health Care Act ACA plans is over $10,000 for an individual and almost $20,000 now for a family. Core coverage, like an employer ACA plan, still is likely going to leave out-of-pocket exposure, and the Health Protector Guard fixed indemnity plan can help fill those gaps. I'm going to take you through the 3 core HPG plans, but if you don't mind, I want to look at this slide with you, and I've shared this slide with Jeff and with Ryan over at Cornerstone in the past. If you look at the bottom left of the screen, and this is showing you the impact that the enhanced subsidies not being approved is going to go and how it's going to affect your customers. I always use the state of Florida when I quote. If you'll look down at the bottom left, a family of 4, married male, married female, 2 children, Miami-Dade County, zip code of 33030. That's sort of the average quote around the country. And as you all know, I showed you the map earlier, we're nationwide. So I want to use an average quote. But if you look at with the enhanced subsidies for the cost of the silver plan for this family of 4 in Miami-Dade County, $885 a month. With the expiration of the enhanced subsidies, it doubles to $1645 a month. Same goes true with a bronze plan at $478 a month. It triples to $1238 per month without the enhanced subsidies. There's a lot of folks out there that aren't going to be able to afford to continue their ACA plan for 2026. If you look at the top right of the screen, the Health Protector Guard as an option for this family of 4 in Miami-Dade County quotes out at $393. I've highlighted that for you. And then I've also highlighted the ACA Silver Monthly Plan Premium. That's saving that family $1,252 a year. Now, for quoting purposes, with the Health Protector Guard, our critical illness, critical guard, accident-wise, and the dental plan for this family, we're still at $685 a month versus $1,645 for the ACA Silver plan. So it is a great options. It's a great option for those clients that cannot afford to get into another ACA plan. So running a business as a broker and agent, you've all got to make money, to keep your business viable. and to pay you for all the hard work that you do. Just to kind of show you here the difference in first level, broker level commission for the package of products that I just shared with you for this one family. You can see the Health Protector Guard, the critical illness, the accident wise, the dental wise plan. First year broker commission pays you $2,502 for the year versus ACA, which is priced out at $20 per member per month, pays you annual commissions of $960. So there's a way to grow your business, offer your clients a lower cost premium to be able to get into for protection for their family with a Health Protector Guard, but also it's going to pay you as agents to keep your business viable and continue to grow your income as well. So Health Protector Guard, it is a fixed indemnity product, meaning the plan provides your customers with fixed benefits based upon the covered services that they receive. The plan benefits are paid per covered person for eligible medical services and paid regardless of the actual expenses incurred. The fixed benefits can help eliminate, like I said earlier, or alleviate the out of burden for the out-of-pocket expenses. Another great thing about these Health Protector Guard plans is the inclusion of our Healthiest You telemedicine service. Telemedicine benefits included automatically. It gives your clients round-the-clock access to providers right over the phone, 24/7, 365 days a year. Your customers can meet with a doctor by phone, video, I was going to say Facebook, but I meant FaceTime, excuse me, and at no extra charge to them. The provider can diagnose and treat illnesses 24 hours a day. And in most cases, for something minor, they can call prescriptions in to their local pharmacy for the client. Very, very convenient for those of you that are familiar with telemedicine. I think you'd have to agree with that. In addition to what you've seen, the standard fixed indemnity HPG3 Health Protector Guard plans feature a calendar year maximum of $2 million per calendar year, lifetime maximum of $5 million per covered year. Here's some other important details about the standard and the guard plans. And remember that the HPG is another option, with the short term being another option for ACA. So I didn't want to confuse you by going a little bit too quick through these slides. But the Health Protector Guard plans have no deductibles. They have no application fees. The plans include an initial 12-month rate guarantee. The plans are medically underwritten. The application, again, has simplified yes or no underwriting questions, and the applications are processed as accept or reject, so you'll know right away when you're helping the client fill out their application. Also, pre-existing conditions will not be eligible for the first 12 months of the plan. The clients will have a 10-day free look period, and the clients can apply for this coverage year-round. There is no enrollment period restrictions. So I'm going to show you the benefit grids on the 3 core plans that can be sold as standalone plans for those clients that choose this option. As all of you know, in this business, we are all PhDs in medical insurance. We know how things work, but for a lot of the clients on the other end of the phone with you or sitting across the desk from you in your office, you don't want to confuse them with too many details because a lot of this is really foreign language to a lot of clients. So what I like to do is just provide the client with examples of how that coverage is going to be used should they need to use the plan benefits. Doctor visits, very important. On the 3 different core plans, they're going to pay $80, $100, or $150 per visit. Each client, each person on the plan is going to get 4 visits a year for year 1, and year 2 plus they're going to get 6, 8, or 12 doctor visits per year, payable at that $80, $100, and $150 visit, regardless of the actual charge. Name brand prescriptions, we're going to pay $40, $60, and $60 for the 3 plans. Generic prescription drugs, $10, $20, and $20. We're going to pay the client that amount of money. So as I told you, I want to share with you how a doctor visit will work. And again, this comes right out of the brochure, and I can assure you, United Healthcare, being as large a company as we are, We're 6th on the Fortune 500 list. I tell you that because we've got to be very careful about what we put in writing to a client. So I always advise that if we put it in writing and we put our United Healthcare name on it, by golly, it's going to be accurate. So again, the network is large. A doctor office visit example would be client gets a sinus infection, makes an appointment with one of our 1.8 million providers nationwide, coast to coast. Actual treatment cost comes in at $175. We're going to apply our United Healthcare Choice Plus network discount, which results in the bill being reduced to $72. This HPG 4000 plan is going to pay $100. In this case, we're going to pay the doctor $72, and we're going to send a check to the client for $28. Here's some other examples for hospital admission, room and board. And at the bottom there, as I said, our plans can be auto adjudicated. So if it's a doctor in network, Health Protector Guard, just like the short-term plans with with United Healthcare Choice Plus network, will pay the doctor directly that benefit. And this is in the brochure. It's a great tool when explaining plans to your clients. Physical exams on the 3 plans pay $100, $125, $150, one per year. Mammograms for females age 30 plus. You can see the benefits levels that we pay in year 1. Those all go up into year 2 plus as an incentive for the clients, to remain on the books. Colonoscopies age 50 plus, preventative or age related, $500 or $700 depending on the plan that they pick. For hospital services, and something that's easy to remember, the Select 2000 plan at the top of the chart pays $2,000 per day while the client's in the hospital. Preferred 4000 pays $4,000. Premier 5000 pays $5,000. So we've coordinated the name of the plan with the hospital confinement reimbursement. In year 2, we double that to $4,000, $8,000, and $10,000 per day. Surgical benefits depend on the severity of the surgery. You can see for the Premier 5000, those are going to pay from $5,000 to $50,000 per day for the surgeries, depending on how the surgery, with other benefits payable as well. But again, I just kind of cover the highlights with the customer. I don't get them too deep in the weeds because a lot of times, as you know, you kind of give them the deer in the headlights look. So if you give them too much information, it's hard for them to digest it and make a decision. So surgical tiers, as I said, are dependent on the severity of the surgery. And you can see how the different plans pay. Tier 1 surgeries are going to be for big major things. Those pay out a lot more. Minor things like removal of tonsils in Tier 7, adenoids, breast biopsy, creation of eardrum opening, basically tubes in an ear for a child. Those are going to pay a lot less because those are outpatient surgeries at a lower cost. So the 3 plans I'm going to show you now, especially for those of you that are still going to maintain some high out-of-pocket bronze ACA customers for 2026. These three guard plans with the Health Protector Guard are the best pairing with the ACA plans. Again, they're going to cover normal doctor visits for illness or injury, 80, 100, 120. They have the same growing number of visits into year 2. They go from 4 to 6. For office visits, these are the 3 guard plans. Again, we've coordinated the name of the plan with the payout for hospitalization at $4,000, $5,000, and $6,000. Surgery, you can see the different levels. And again, surgery is based upon the severity of surgery. So I wanted to close up here and show you a bonus opportunity, for agents. We call this the comeback, which means come back for the short term and the tri-term plans returning, which we're all excited about. The comeback incentive runs from September 1 through January 31st of 2026. And you can see with an EFT payment, the tri-term medical plans, for those of you that have clients in Kentucky and maybe some other states where tri-term is available, we pay $500 for those top tier tri-term plans. Short-term plans, 6 or 12 months, we pay a $100 bonus. That's over and above the commission that I showed you on the previous commission. And then our ancillary plans are all going to pay out somewhere around $50 to $75, depending on the plan. This is another incentive. This thing ends at the end of this year so far, so I'm not going to talk about it. We're kind of close, but there is also an incentive out there, for agents, which we call our first 15, which means that those agents that haven't been active with us in 2024, or those that have been appointed within the last 120 days, would be eligible for this incentive. As Jeff said earlier, the UHC Golden Rule appointment to sell the plans, it's a separate carrier appointment from our UHC Medicare and our UHC IFP, which is the UHC ACA plans. But if you need any to get appointed, reach out to Jeff or Sandy Weber over at Cornerstone, and they can get you appointed with us if you're not appointed already. Another great thing about our plans is when you sign your customers up for a UH1 plan, they all have access to the UHC Member Hub at www.uhcmemberhub.com. Your clients can make payments, update their address, view their policy documents, their ID card, find a provider, and they can manage and submit claims if they don't auto adjudicate based upon the example that I gave you before. Jeff, I'm going to open this up. Do you have? I wanted to take everybody through eStore and show them our Advantage Guard tool. If you believe that we have agents on the line that also sell Medicare Advantage.
I think by and large we have ACA.
Okay.
We do have a few Medicare agents online. If you want to just give us a little, sneak peek, that'd be great. But we want to get to some questions before the end of the hour.
Sure. Well, do you want to do the questions now and see what we have time for, or how would you like to do it?
Go ahead and do eStore, for a quick hot second, if you wouldn't mind.
Okay. Pardon me here. I'm going to have to open up a few things. As you can see, I've got a ton of stuff opened here. So this is just our generic eStore broker portal. But for those of you that quote our products, you'll enter this with your user ID and your password. You'll see your name at the top with all the information on it. But I just wanted to show you here a product. That grid that I showed you earlier, I'm going to open that real quick. It's always on the front page. And that shows you our product availability by state. I'm going to go back, but if I wanted to do an instant quote, so Jeff, if you wouldn't mind helping me out, can you give me a zip code?
45201.
45201, and we're going to select a male. And June 1st of 1955. How about that? Well, we're going to go down here and you can see that person's over the age of 65. So eStore is only going to pull up those products which are available to the senior 65 plus crowd. So for this,
cool.
Yep, go ahead.
Yeah, I like it. Nice dental options. Great.
Okay. So we're going to go into vision. We got vision down here. Mm-hmm. We got accident, critical illness, because those all have issue ages up to 70, 75, I believe. So you've got some things that you could offer there. But for this illustration purposes, I'm going to show you Advantage Guard, the hospital indemnity plan. So I'm going to check it. I'm going to hit View Plans. So it's going to pop up an option showing that you can get this client an Advantage Guard hospital indemnity plan for $36.78. I'm going to go down here and use this plan recommendation tool, which is, I think, is really awesome. So I'm going to click on it. It's going to show 2026. Jeff, if you wouldn't mind helping me, and it's going to pull up all Medicare Advantage plans in that zip code that Jeff provided me earlier. Jeff, give me an idea of a very popular.
Maybe like the MedMutual, just or Anthem. It doesn't matter. Yeah, MedMutual or Anthem. There you go. MedMutual, just up one. There you go. Yeah.
MedMutual of Ohio. Got it. And then it's going to pull up all the plans for MedMutual. So pick me out a plan that you might be familiar with.
Boy,
or popular one.
Try. I'm not. How about the Advantage Classic?
Okay, so what this is going to do is going to put the MedMutual Advantage Classic, which is an HMO in Medical Mutual of Ohio. It's going to put the copays and all the out-of-pocket cost over on the left side of the screen. It's then going to marriage up the coverage levels to the Advantage Guard hospital indemnity. So as an example, for inpatient hospital care, out-of-pocket for the MedMutual Advantage Classic HMO is $350, and you can see the Advantage Guard is going to pay that $350. 7 days of confinement. In most cases, the Advantage Guard is going to pay equal to or more than the out-of-pocket exposure that the customer is going to have on the Advantage Guard plan. And over on the right, any difference, if we overpay, then that money goes back to the client, the overage. So I'm going to update the selected plan, and it shows the quote for the client. It's going to show the network, which is UnitedHealthcare Choice Plus. Again, 1.8 million providers. It's going to show the different coverage levels for zero out of pocket. As everybody knows, a lot of times seniors, you know, they're on a budget. They're on Social Security, so maybe tight. So the Advantage Guard Hospital Indemnity Plan offers a very good option. So I know we're at time here, and Jeff wants to see if there's any questions.
Yeah, thanks, Bill. We do have a few more questions. Okay. Again, circling back to the short term and the conditions and underwriting and that sort of thing. So the question is, what if a cancer, and let's say it's a curable cancer, in this case, in a hysterectomy took place, and they only see an oncologist for monitoring once a year. Do you think any chance that would pass?
No. Okay. No, I'm going to tell you, and
internal cancer.
Being in sales, I don't give I'm going to give you the accurate answer. Typically, if it's something small, like a skin cancer that's not life-threatening, they would accept something like that. Yeah. But anything that's going to be major, since this, it's probably not a good idea. I'm going to send this over to you, but let's go to the next question, Jeff.
Well, the next one is more to do with timing. Can you, in the short term again, can you ask for a future date of 1/1/26?
Yep.
Sure cool. Can. Okay.
And we won't pull premium. Just remember that when you apply, if you're going to apply for a client now for a 1/1 start date, obviously when their other coverage ends on the 31st of December, you would need to select. There's going to be a toggle switch. You can pay at issue date. So if that plan issues, but the effective date is not until 1/1, you won't want to have that first month premium pulled out until 1/1, which is the effective date.
Yeah, mid-month effective dates. Let's say you want to do 12/20 or 12/25. Okay. Mm-hmm.
Yeah. After month one is going to be either when the plan issues, which can be as quick as 24 hours, or effective date, whatever the customer chooses on the application. But after month one, if those customers want it pulled out at a certain date, yes, that can be accomplished. Was that
okay?
Yeah.
Yeah. Very flexible. They've always been very flexible. You guys are the industry leaders when it comes to short term. Like you said, didn't you guys pioneer the short term product, or more or less,
Yes,
on the front page of that.
Jeff knows the story. United Healthcare purchased Golden Rule Insurance Company a long, long time ago. 20, well, I don't know how long I've been there, but
As long as
anyway,
I've been here, yeah.
the Rooneys started Golden Rule Insurance Company. They were the big dogs, the only ones in the individual market. Blue Cross and Blue Shield and United Healthcare, they were basically group employer-based coverage carriers. And so United bought Golden Rule Insurance Company because they were the biggest out there. And the Rooneys are the ones that started the short-term plans. The Rooneys are also the ones that started the old medical savings accounts, which evolved into the healthcare savings
The old
accounts.
Archer savings accounts. Everybody remember those? That's where so many people do. Yeah, those are good.
Yeah.
I think that's where we're headed. So, yeah.
Any other questions, Jeff?
I did a great job, Bill. I mean, man, again, we're popping champagne corks over here. I'm getting a lot of texts from colleagues and stuff. You guys are excited. I got a couple new posts here. Let me see what's going on here. What happens at the end of the year of a three? What happens at the end of year 3 on a tri-term? So this must be a Kentucky client. Can they re-up for another 3?
Sure.
Okay.
Same way with the 12-month. Once the 12-month ends,
if there were 4 years from Medicare. Yeah. So again, we're looking. Yeah. I mean, we're in that zone. We're in the retirement zone for a lot of agents. We're looking at people in their late 50s, early 60s, and they want to get to 65.
Yep.
And hope Irma doesn't bite too bad. So, and they know what that means. So, I think that's it, guys. Fantastic. Everybody will get a copy. Actually, the presentation will be housed out on our resource page, and but everybody will get a follow-up email. And terrific job. Stay in touch with all of us. If you haven't been appointed with Golden Rule UH1, let me know. We'll get you started lickety split. And Bill, any final thoughts?
No, sir. Again, I just want to thank everybody. This is your busy time, and thank you, Jeff, and thank you, Ryan, for all the great things that Cornerstone does for not only your agents but also for our company. We certainly appreciate it. We've been partners a long time, and so we're here to help you grow any way we can.
Fantastic, Bill. Everybody, have a great day.